Here she is. Good morning, Danielle.
Hey there, how's it going?
Good.
Excited to be here. Let me just move my camera a little bit there. Yeah, we're just in my kitchen right now, and I have a 2-year-old and just had a baby 2 months ago. So there's always somebody needing something, hands-on, snuggles, tears, poop, pee, the whole gambit, right?
It's real. It's super real. Well, we're going to disappear and let you chat with everybody. So,
Okay, thanks.
everybody, this is Danielle.
Hey, so I just want to say thanks to Sarah and Olivia for making this happen because I know how much work this was to pivot from the online event or from the in-person event to an online event and figuring out Zoom and just the logistics of all of this. So just really appreciate all of your hard work and effort to make this happen. And I'm excited for this because I get to talk to you guys about chiropractic care during pregnancy, but I also get to learn from all the other providers who are on the panel, which I think is phenomenal to know who else is in our community and can help my patients. If they're going through something, I know who to send them to. So, yeah, and then just thanks for everybody who logged on today and wants to learn about all the different types of options for care, for your pregnancy, all the different service providers that are out there as well who are going to be speaking today. So I don't know where you are in your journey to parenthood, whether you're just researching today, thinking about becoming pregnant, if you're pregnant right now, or if you just have a little one at home, but welcome. So excited to be with you today. So I'm Danielle McCary. I'm a chiropractor here in Portland, and I own Laurelhurst Chiropractic with my husband, Dr. Phil. And we've been running the clinic for 6 years, but it's been a staple in the community for over 30 years now. And I've been in practice for almost 10 years. It's gone by really fast. And our clinic is over on 28th and East Burnside. We're right next door to the Laurelhurst movie theater, and we actually share the parking lot with them, which is wonderful to have parking on site. It's kind of rare sometimes in the Portland area. And then our clinic treats a wide variety of conditions and injuries, a wide variety of patients, but my real passion is to help families in their parenthood journey. So, working with pregnant moms, helping support dads, and just making your pregnancy as comfortable and as a magical experience as possible. So it's kind of funny though, I actually didn't think that that was something I wanted to focus my practice on initially when I was, becoming a chiropractor. I had worked at a sports med clinic before going to chiropractic school, and that's just what I thought I was going to do. I thought I was going to go back and treat athletes, and I'd always really enjoyed working with athletes and helping them achieve their goals and get over injuries. And then once I started into practice and treating patients and taking more continuing education courses, I realized how impactful working on pregnant patients could be. And and then having my 2 daughters really reinforced just how amazing chiropractic can be for pregnancy. I had a lot of injuries just from life and sports, and so I would have been in trouble without getting adjusted and getting some regular care. So why see a chiropractor during your pregnancy? I think patients come in for a lot of different reasons, but I think it boils down to a few main ones. So you're having some sort of pain, you're having loss in function, you're coming in because of your baby's positioning, or you're coming in for wellness. So I think the main reason that I see patients is they initially come in because they have pain. And the most common area of pain that I see is low back or pelvic pain. Some studies have showed that up to 80% of women during pregnancy have some sort of low back and pelvic pain or discomfort. And chiropractic care is amazing with treating that. And then the next area that I see a lot of is neck pain and headaches, and that can be from hormonal changes, but a lot of it can do from postural changes as well. So, your core is different, you're moving differently, and it can put a lot of stress on your neck. And then also upper back and shoulder pain, you're having to sleep in awkward positions, trying to get comfortable, tossing and turning. Maybe you're lifting differently because you're trying to avoid hitting your belly. You're just moving differently, and that can really affect your upper back and shoulders as well. And then the next area that I said was decrease in function. So you've lost the ability to do something. Maybe it's you're having trouble at work, you sit all day at a desk job, or you're on your feet all day and that's becoming really difficult, and you want to try and ensure that you can stay at work as long as possible up to your maternity leave, or maybe you're chasing around a toddler and it's getting really difficult as well. And then breech or transverse baby positioning, maybe your MD or your midwife referred you to a chiropractor for care to help with fetal positioning. And I think more and more providers are realizing that chiropractic care can be really effective and beneficial to help with that. Before they try an in-office treatment that might be a little more invasive or a little bit more painful for mom. And then wellness. A lot of ladies are trying to do anything they can during their pregnancy to really make it more comfortable, and then also help with having a smooth labor and delivery process, and hopefully decreasing the need for any interventions. So the good news is that chiropractic care through research has shown to be helpful for all of these things. So if you have questions, if those actually can be treated, that's the case. And I know a lot of women worry about having different treatments done if they've never been to a chiropractor, but chiropractic care is really safe. And it doesn't have any negative impacts on you or your fetus. So it's a gentle and effective way to help mom through pregnancy. And so what is it we do when you come in for care? And I think a lot of people have different ideas about what goes on in a chiropractic office. So for pregnant patients, we use a treatment protocol called Webster technique, and it focuses on using low force to treat the pelvic joints, muscles, and ligaments that are growing, expanding, stretching during pregnancy. And what we do is help maternal positioning, so mom's position, to decrease pain and discomfort. But we also are ensuring that the pelvic bowl that the baby is going to be traveling through is in an optimal position to help with labor and delivery. And when we get to use a special pillow with pregnant patients, so I'm going to pull up a little picture here. And these photos were taken by the lovely Ashley, who is going to be speaking later today. But as you can see, the pillow has cutouts for breasts and belly. And so it really allows our patients to get comfortable on the table. It allows me to have full access to their spine and pelvis and really evaluate everything. And then it's where some ladies just want to come in and lay face down for a little bit, and I can't blame you for that. It feels really good after not being able to lay in any position, but on your side for a while. So it's nice to be able to be face down. And chiropractic care is also great postpartum. We can ease a lot of pain and discomfort after your delivery, or when you're feeding your baby, trying to soothe your baby, holding them throughout the night. I know recently I felt a little bit like a hunchback, so really happy that I can get chiropractic care. And we also do a couple other types of treatments in the office. We're definitely not cookie cutter. So, some patients need a little bit of muscle work. We use taping as well to support the belly and your back. And then along with our, on like in-site treatment and our hands-on treatment, we also recommend stretches and exercises that can be really useful to help decrease your pain. And then also at home exercises and positions to help if you have a breech baby, which can be really effective. And our office is currently open for treatment. We're taking all the precautions recommended by the state and the CDC to ensure the safety of our patients. So extra cleaning, we're wearing masks, we have air filters, 6 feet of distancing, no one overlaps in the waiting room. So just anything to really make our patients feel comfortable and safe. And while the majority of our treatment is hands-on, there's a lot we can do through telemedicine. So I've actually got to work with a couple of ladies already who have had breech babies, and we can give, like I said, at-home exercises and positioning that you can do so that you can help facilitate your baby moving into the best position possible for your labor and delivery. So that's an option as well if you're just not feeling comfortable with coming in for a treatment. And so I guess in summary, chiropractic care using Webster technique is a really safe and effective way to help you throughout your pregnancy, and decrease your pain, discomfort, and just help ensure that your labor and delivery can go smoothly as possible. And we really do want you to have the best experience while you're going through your pregnancy. You can reach me at the clinic through our phone number, which is 503-234-4288, or our clinic website is laurelhurstchiropractic.com. We're also on Facebook and Instagram, and our Instagram handle is Laurelhurst Chiro PDX. $5 discounted examination fee for the first 5 who book. And just thanks again so much for having me today, and I'm excited to hear from everybody else.
Thank you so much. That's awesome that you're offering that discounted fee. That's great.
Yeah, and then we also take most major medical insurance providers. So if you're, have insurance and want to see what's covered, we can also call and verify your benefits for you.
That's fantastic.
Yeah.
Great. Well, thank you for joining us this morning, Dr. Danielle. We really appreciate it.
Thanks for having me, you guys. I'm excited for the rest of the event today.
Okay, bye.
Bye.
Here is the wrong information.
Secrets.
Let's try that again.
So listening to Dr. Danielle talk, one of the things that I wanted to jump in and say about my experience with Laurelhurst as a patient is she said something about not doing cookie cutter care. And that's pretty much precisely the reason why I changed chiropractors, was because I was feeling like the chiropractor I saw before. I would come in and she'd be like, all right, this girl gets like crack out the door. And I feel like every time I go into Laurelhurst, I have a conversation about what's happening in my body today and this past month, and really addressing what's happening to me now, as opposed to the injury that I had that brought me in and were just adjusting me that way forever and ever. So that's something I really appreciate, speaking from personal experience.